Welcome to my channel. 1. What do the kidneys mainly do? A. Produce hormones. B. Filter blood and get rid of waste. C. Control body temperature. D. Help with digestion. The answer is A. Produce hormones. 2. Which part of the nephron is mainly in charge of filtering blood? A. Glomerulus. B. Loop of Henle. C. Collecting duct. D. Proximal convoluted tubule. The answer is A. Glomerulus. 3. Where is the filtrate from the glomerulus collected before it goes to the tubules? A. Renal pelvis. B. Bowman's capsule. C. Ureter. D. Minor calyx. The answer is B. Bowman's capsule. 4. What does the loop of Henle do in the nephron? A. Reabsorb glucose. B. Concentrate urine. C. Secrete hormones. D. Filter blood. The answer is B. Concentrate urine. 5. Which hormone mainly helps balance sodium and water in the body? A. Aldosterone. B. Insulin. C. Adrenaline. D. Cortisol. The answer is A. Aldosterone. 6. Which part of the nephron mainly regulates the final concentration of urine? A. Distal convoluted tubule. B. Collecting duct. C. Proximal convoluted tubule. D. Glomerulus. The answer is B. Collecting duct. 7. What's the main job of antidiuretic hormone, ADH, in the kidneys? A. Increase the glomerular filtration rate. B. Promote water reabsorption in the collecting ducts. C. Enhance sodium reabsorption in the loop of Henle. D. Increase urine production. The answer is B. Promote water reabsorption in the collecting ducts. 8. Which structure carries urine from the kidneys to the bladder? A. Urethra. B. Ureter. C. Renal pelvis. D. Nephron. The answer is B. Ureter. 9. What's the functional unit of the kidney called? A. Glomerulus. B. Nephron. C. Renal tubule. D. Bowman's capsule. The answer is B. Nephron. 10. Which substance is usually not found in urine but can show up in cases like diabetes mellitus? A. Urea. B. Creatinine. C. Glucose. D. Uric acid. The answer is C. Glucose. 11. Which structure in the nephron is encased by the Bowman's capsule? A. Proximal convoluted tubule. B. Loop of Henle. C. Glomerulus. D. Collecting duct. The answer is C. Glomerulus. 12. What is the main function of the proximal convoluted tubule, PCT? A. To filter blood. B. To reabsorb nutrients and water. C. To secrete waste products. D. To concentrate urine. The answer is B. To reabsorb nutrients and water. 13. In which part of the nephron does the countercurrent mechanism take place to concentrate urine? A. Proximal convoluted tubule. B. Distal convoluted tubule. C. Loop of Henle. D. Collecting duct. The answer is C. Loop of Henle. 14. What is the primary role of the distal convoluted tubule, DCT? A. To reabsorb glucose. B. To reabsorb sodium and water, and secrete potassium. C. To filter blood. D. To produce urine. The answer is B. To reabsorb sodium and water, and secrete potassium. 15. How does antidiuretic hormone, ADH, influence the collecting duct? A. It decreases water reabsorption. B. It increases sodium reabsorption. C. It increases water reabsorption. D. It decreases potassium secretion. The answer is C. It increases water reabsorption. 16. Which section of the nephron is primarily responsible for the majority of sodium reabsorption? A. Glomerulus. B. Proximal convoluted tubule. C. Loop of Henle. D. Collecting duct. The answer is B. Proximal convoluted tubule. 16. Which section of the nephron is primarily responsible for the majority of sodium reabsorption? A. Glomerulus. B. Proximal convoluted tubule. C. Loop of Henle. D. Collecting duct. The answer is B. Proximal convoluted tubule. 17. The juxtaglomerular apparatus plays a role in regulating which aspect of kidney function? A. Glomerular filtration rate. B. Urine concentration. C. Hormone secretion. D. Blood pH balance. The answer is A. Glomerular filtration rate. 18. Which statement about the filtration barrier in the glomerulus is accurate? A. It is permeable to large proteins. B. It consists of fenestrated endothelium, basement membrane, and podocytes. C. It allows all substances in the blood to pass freely. D. It filters out only small molecules and retains all cells. The answer is B. It consists of fenestrated endothelium, basement membrane, and podocytes. 19. Which part of the kidney is responsible for filtering blood to form urine? A. Renal pelvis. B. Renal cortex. C. Renal medulla. D. Nephron. The answer is D. Nephron. 20. The renal artery supplies blood to the kidneys. From which major artery does the renal artery branch? A. Abdominal aorta. B. Femoral artery. C. Pulmonary artery. D. Inferior vena cava. The answer is A. Abdominal aorta. Thanks for watching. Subscribe the channel.